40 years in when it comes to Kenya managing in as far as prevention and treatment of HIV and AIDS. Now, as we mark 40 years anniversary, we want to know the inroads that have been made and the challenges they're in. Taking us through this conversation is none other than Dr. Samuel Kinyanjui, who is a country director, AIDS Healthcare Foundation. Thank you very much for your time.
Thank you.
Now, let's pick it up from here. Do you know your current HIV AIDS status?
Yes, I know my HIV status. It's extremely important that each one of us knows their HIV status. And the current guidelines is that every year somebody needs to check their HIV status. I know they've been talking about every 2 years, but I make sure I do it every year.
One, at least annually.
Yes.
Now, I've asked that question because from that report that has been shared from UNAIDS, it indicates that there's still a lot of stigma that is attached with the HIV AIDS, status. 40 years in, we're still dealing with that. Why is it so?
I think there are many reasons, but I would consider two very key. One of them is that as healthcare workers, doctors I am, and other healthcare workers, we've always treated HIV very differently. And each time you treat it differently, then people get scared about it. The other thing is that we associated HIV infection to be a sexually transmitted infection, which borders on an issue of a person's morality, and which therefore brings shame. So I think for these two main reasons, the mortality that was attached to the HIV status initially, and the current status that HIV infection is related to a moral standing of an individual, I think for those two reasons, we have perpetuated this stigma.
Would changing the communication strategy actually help in this?
I strongly believe so. We have more significant and scaring diagnosis, for example, a diagnosis of having a cancer. And when a doctor is suspecting that a person may be having a cancer, the issue, a prescription, go for this and this test, then we come back, we will discuss what the outcomes are. But when they are thinking about HIV, they want to send you to a counselor first for 30 minutes, then from the counselor, then the testing, then after the testing, then another counseling session. We make the whole issue look very scary.
Very scary. So the process, from knowing your status to actually now seeking care and management going forward.
Yes.
So I think there's a call to action to change that strategy. Now, from that also report, we are seeing that the infection rate has gone down by 75% for Kenya's case since 2010. Why do you think this is so right now?
I think first of all, as Kenyans, we need to congratulate everybody who has participated in this, from the national and county government to the development partners, and the communities themselves who have agreed to the call to come in for testing and to take on treatment. Because as more people have gotten into treatment, then they have attained viral suppression, and therefore they are not transmitting to their sexual partners. So that treatment has contributed a lot to this. But also the increased use of prevention, safe sex approaches, like use of condoms, that has also contributed. Okay. Yes.
So now we've made inroads there, but then we've also seen other interventions that have come into this particular value chain, and this is in the introduction of the PrEP,
yes,
and the one after
PEP.
PEP.
Yes.
How has been the uptake so far?
I'd like to say that the uptake initially was good, but the challenge is that when it's coming to taking medications, most of us find it difficult to be consistent. And that's where the challenge lies, that they may take the medication for some time and then drop off before they complete the time. And therefore risk that if they had an infection and the virus survives, then the virus will develop resistance and become a challenge when it comes to treating that kind of a virus.
Now, Daktari, before we take our first break on this particular conversation, let's unpack what PrEP and PEP is, because I think there's a lot of miscommunication in that, so that our viewers can understand.
PrEP is PEP. Let's start with PEP. PEP is after somebody has been exposed.
Yes.
For example, they were in the act, and the condom burst or something like that, or they get engaged with somebody, they didn't know they were HIV positive, and then they come to discover. Alternatively, like healthcare workers, they get a cut or a needle prick and operating a patient who's already known to be living with the HIV infection.
Yeah.
PrEP is pre-exposure.
Pre-exposure.
So you are preparing because of the somebody is preparing because of the nature of their life where they live on what we call the first lane. They are at higher risk more than the general population. For example, the sex workers, people who inject drugs, and men who have sex with them, MSMs.
Okay. And on that note, we take a quick breather, but when we come back, we're going to look at the inroads that have been made so far and the challenges for those who are in this particular value chain. It's World HIV and AIDS Day. What have we done so far, and what are the challenges therein? So, Daktari, let's look at now when you talk about the prevention and management of this, the financing when it comes to matters of treatment. We know Kenya does not manufacture condoms.
Yes, we know.
We do not manufacture condoms.
Yes.
We are heavily reliant on donor aid to actually work on prevention and treatment, actually. If we look at the medicine, we are looking at billions. And of late, you have seen the withdrawal of these donors from actually, giving their support. And government, there's still a gap. How then does this affect where we are, and what can we do?
Thank you very much. You've gone to the core of the matter that we are looking at now. People working in this sector, the clients who benefit from the HIV life-saving treatment, because it's truly life-saving treatment, are very worried right now. We've seen gradual reduction funding from the U.S. government through PEPFAR program, funding from Global Fund. I think the word out there is that the current Global Fund, which ends in 2027, will be our last. And maybe the U.S. government funding may be coming to an end by 2030. But even right now, it's significantly reduced, and as a result, a lot of the healthcare workers who are being funded through PEPFAR programs, implementing partners, have been either significantly reduced, and as a result, the quality of care for people living HIV and TB is significantly affected. First of all, I'd appreciate the national government. In terms of TB, the national government buys 100% for all TB medication used by adults in Kenya. That for children is being provided for by funding from donors. But for HIV medication, I still believe approximately 70 to 80% of the drugs are still donor funded. And this would be a huge blow, because I think the numbers comes to between 25 to 27 billion Kenya shillings to provide this HIV medication.
Now, we have seen the government transit from NHIF, and now we are dealing with SHA.
Yes.
And from statistics, it indicates that SHA does not cover HIV and AIDS. What to do?
Yeah, that is a big problem we have. It's a huge cry, particularly from the people living with HIV infection, because HIV, as long as we have ARVs, HIV infection now has transited from being an acute illness that can kill somebody within a few months to a year, to a chronic illness, just like hypertension or diabetes, particularly resembling very much in terms of clinical symptomatology to diabetes. And the request from the people living with HIV infection is that they be accorded the same amount of budget, the same amount of rate, about between 4,500 and 4,800 per year, per person, so that this one can cover their cost of consultation. It can cover their cost of lab works.
Did you say 4,800 per year?
Per year. 4,800 is sufficient per year, because that will cover their consultation. Their consultations are very cheap. Most of the places just consult for about 200, 500 to 252 to 500. And then the remaining amount of money will be spent checking how their kidneys are functioning, how their liver is functioning, how their thyroid is functioning, how is their blood situation, are they anemic, so that we make sure that the medication we are giving them is beneficial rather than injuring their vital organs.
Now, you've said chances are come 2027 will not have the monies under the Global Fund. As an NGO that is already within this particular value chain, are you going to be closing shop in Kenya?
No, not really. AIDS Healthcare Foundation is not dependent on Global Fund or PEPFAR. It is self-funded.
Self-funded,
from the businesses that the organization does in the US and other countries in the developed economies. And therefore, we will not be directly impacted, but we will be impacted if the drugs and some of the lab materials are not provided through, which we get through the national government and also from this from Global Fund and PEPFAR. So the quality of care we give to our clients will be affected.
Dr. Were you part of the consultation that was currently undertaken by government, you know, as we were transiting from NHIF to what we currently have? We have the Shisha, as we're calling it, and now we have another name, Taifa Care and such. Were you part of those? Did you put forth your concerns, and do you think they were taken into consideration?
As part of the civil society working in Kenya, we use two platforms. One is HENET. Those are an umbrella of all NGOs working in the health sector. And then we also used NEFAC, which is an umbrella of people living with the HIV in Kenya, to make our request known to the national government. And during those engagement, we were reassured severally that no one will be left behind.
But then do you think we have been left behind?
We can see that people living with HIV infections have been left behind.
Wow. All right. Now, the crux of the matter also in as far as new infections is that the youth, the Gen Z, there's a high rate of infection among this particular demographic. Why do you think this is so?
I think there are many reasons, but the key reason that we think is contributing to this, first of all, is that the level of awareness about HIV infection, how it's transmitted, and how dangerous it can be, is not clear in the mind of the young people. People who are born after the ARV became prevalent, and they have not seen anyone grow so thin and die. They've not seen anyone being buried in a polythene bag. They don't think that HIV is dangerous. They actually are more scared of being pregnant than getting contracting HIV.
And then is this then affecting the fight against, HIV and AIDS prevalence?
Yes, because to them, safe sex is not a concept that they appreciate.
So what do we do? That's a challenge right there. So what do we do?
We need to go back and see what works, how we can communicate using the current platforms, not the old billboards.
Yes.
They are not there. They keep telling me, if what you're talking to me is not on the phone, I can't Google it, then it doesn't exist. So we need to use the social media platforms that are currently available to get the message to them. From the marathon that was just concluded this morning, the uptake was registration was not very good until we got the influencers, social media influencers, 3 of them. And within 2 days, nearly 2/3 of the people who are running today registered. And therefore, we need to use these social media influencers to get the information across. Because those are the people that our young people look up to, listen to. Not the usual, not the usual platform.
Yes.
Number 2, we also are noting that a lot of the time is that these young people are getting transmission mainly from the young girls, because they are predominantly the young girls who are infected more, are getting infection from older men, 40, 45, 60. In fact, Dr. Masha today was giving us the statistics of retirees who are coming down with AIDS, not HIV infection.
Wow.
Do you find somebody in HDU only to discover that's when you are discovering, oh, they have HIV infection and they're already in advanced HIV disease. And it is Mbaba culture and the college girl.
Wow.
That's where the issues are.
As a doctor, what are you doing as you come to a close? As a doctor from where you sit, where do you think we can work? Because now that is more, it will require a behavioral change.
There's behavioral change, but there's also the need for concept of safer sex. Because intergeneration, we cannot stop it. We cannot get in that space, but we can make it safe. Whoever plays in that space, let it be safe.
Safe sex.
Safe sex. Because the concept, like you go to the Western countries, they're active or even more active than we are. But the concept of unsafe sex is unknown. It feels like a taboo. Somebody could always be excommunicated by his group if they are known to be engaging in such kind of behavior. Yes.
That is
And in addition...
Now, parting shot as we are finished.
In addition, we also need to remember that we are social beings, and we not only are a body, we also have a spiritual part of our concept. Yes. And we need not to leave out the religious leaders out of this. We have our religious leaders, we have our cultural leaders who impact the values that people grow up with. And you know, they say, give me your child until they are age 12, 10, 12, and I'll show you the man or the woman. So we need, the parents need to play their space, but we also need not to forget the religious leaders and other cultural leaders who guide the moral fabric of our society.
I think we need to have this conversation more, because then when you bring in the religious leaders, there was talk about sex education, and it really caused a stir in the country. But that's a conversation for another day. We have been engaging none other than Dr. Samuel Kinyanjui. He's a country director, AIDS Healthcare Foundation, as Kenya joins ranks with the rest of the world in marking World AIDS Day. Looking at statistics, the infection rate is down by 75% from the data in 2010. However, stakeholders in this value chain are worried about the youth, the Gen Z, who do not seemingly understand the concept of safe sex. For now, take a quick breather. We'll be back with what has been making headlines in the last 8 hours. You're watching Sunday Express.